Hello, welcome to another episode of Arthritis and You, a Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
Welcome to the deep dive. Okay, think about your spice rack for a second. There's probably something bright yellow in there.
Turmeric, right.
Exactly. That spice that makes curry powder yellow, gives mustard its kick, sometimes even colors butter or cheese. It seems like it's everywhere.
It really does.
So here's the question we're tackling today. Could that very common spice actually be, maybe, a shortcut to better health? Specifically for something like joint pain.
That's the big question.
That's our mission for this deep dive. We're really digging into turmeric. You hear so much about its health benefits, especially for things like arthritis, rheumatic conditions.
Right. There's a lot of buzz.
A lot of buzz.
Yeah.
So our goal is to cut through that noise. We want to see what the science actually says, not just the hype. We're using sources from Alberta Rheumatology, their website, a recent YouTube video, to get the real story.
And this is so relevant for you listening right now. I mean, tons of people are curious about natural health products, aren't they? And it's easy to get lost in all the claims. So we hope this deep dive gives you some clear, evidence-based knowledge, helps you make informed choices about managing joint pain, and maybe just as important, understand potential interactions.
Yeah, those interactions are key. It's about having reliable info.
Exactly, empowering you.
Okay, let's start unpacking this. Turmeric. We know it as a spice, but what is it really? And what's this key thing inside it everyone talks about?
Well, fundamentally, it's a spice from the turmeric root. Simple enough.
Right.
We know the culinary uses flavoring, coloring curries, mustards, like you said. But the health buzz, that really centers on curcumin.
Ah, curcumin. That's the word you always hear.
Precisely. It's a yellow pigment in the root, and it's one of the main active ingredients. It belongs to a group called curcuminoids.
Okay, curcuminoids.
Yeah. So you might hear different names thrown around: curcumin, curcuminoids, turmeric root, sometimes the scientific names, curcumalonga or curcuma domestica.
Got it.
But they're all pointing to this plant, and often specifically to curcumin as the powerhouse.
So curcumin is where the supposed magic happens. Why so much attention? What's the traditional thinking behind using it for health?
Well, what's fascinating here is how a simple root contains compounds with such, powerful sounding actions,
Yeah.
And that's where the buzz comes from. Turmeric has a really long history in traditional medicine. It's been used specifically for managing osteoarthritis, that's OA, and also rheumatoid arthritis, RA.
For both. Interesting.
Yeah, traditionally for both. The idea was it could help reduce joint pain and maybe improve how well people could move.
And how is it thought to work?
The proposed mechanism why people thought it worked comes back to curcumin. Studies, especially lab studies, have shown that curcumin can reduce inflammation.
The anti-inflammatory effect.
Right. And it also seems to act as an antioxidant. So this combination, anti-inflammatory and antioxidant, that's really why it's captured so much interest.
Okay, that sounds quite promising on paper. Anti-inflammatory is a big deal for joint pain. But does it actually work when you test it properly? What does the science say? What's the bottom line from the sources we looked at?
Yeah, the bottom line is, it's nuanced. The overall summary is that turmeric may modestly improve pain, specifically in knee osteoarthritis.
Modestly improves.
And importantly, it seems likely safe when used appropriately, but typically only studied for up to about 8 months.
Months. Okay.
But digging deeper, the evidence isn't uniform. So for both OA and RA, some limited research suggests that a specific turmeric extract, say 500 milligrams 2 to 4 times a day, might be modestly effective.
Might be.
For reducing pain and improving function, but you need to take it for about 6 to 8 weeks to see that potential effect.
6 to 8 weeks.
But here's a really critical distinction. When it comes to rheumatoid arthritis, RA, there's a specific lack of reliable evidence supporting its use.
Really? Despite the traditional use?
Exactly. Even though it was used traditionally for RA, the strong, rigorous scientific studies just aren't there to back it up confidently yet. And if we connect this to the bigger picture, it really highlights how important it is to separate that traditional or anecdotal use from what solid scientific trials actually show us.
That's such a key point.
Yeah.
Because natural often gets equated with safe or effective automatically in people's minds.
It does.
So does looking at specific studies, especially for knee OA, where there seems to be some positive signal, challenge that simple assumption.
It definitely does, and that's why drilling down into individual studies is useful. For instance, there was a small study using a commercial turmeric formula called Merive.
Merive, okay.
Yeah, they used 500 milligrams twice a day, and it did show a modest reduction in pain and some improvement in function for people with knee OA.
Modest again, so consistent theme there.
Pretty consistent, yeah.
But then there's this really interesting study you mentioned, the one comparing turmeric directly to a common painkiller. That sounds quite significant.
It was really interesting. It was a 4-week randomized controlled study, quite well designed, with 367 patients who had knee OA.
Okay.
They compared a turmeric extract 500 milligrams 3 times daily against ibuprofen 400 milligrams 3 times daily.
Ibuprofen, one of the standard NSAIDs people reach for.
Exactly, a very common NSAID. And what they found was basically the turmeric extract was non-inferior to the ibuprofen for reducing knee pain.
Non-inferior, so essentially it worked about as well.
That's what non-inferiority means in this context, yes. Both groups actually showed real clinical improvement. They used a standard 10-point pain scale, WOMAC.
Right.
The turmeric group improved by about 37%, and the ibuprofen group by around 41%. Pretty comparable results.
Wow.
And they also looked at how much rescue pain medication people needed, like tramadol, and that was similar between the groups too, suggesting, similar levels of underlying pain control.
That is pretty striking. A spice extract holding its own against a standard NSAID like ibuprofen for knee pain. But what about side effects? Were they the same?
No. And this is crucial. The side effect profiles were different. The patients taking the turmeric actually reported less abdominal pain and discomfort compared to the ibuprofen group.
That's a plus for turmeric.
It is. However, the turmeric group reported more loose stools. Diarrhea was more common.
Okay, so a different set of issues.
Exactly. So, comparable effectiveness for pain, but different side effect considerations. It really drives home that natural doesn't automatically mean side effect free.
Good point. So beyond that direct comparison, what about bigger picture reviews?
Yeah.
Like systematic reviews that combine multiple studies?
Yeah, those have been done too. Several systematic reviews and meta-analyses, looking mostly at OA studies, generally found that turmeric showed a statistically significant benefit over placebo for pain.
Okay.
One review, looking at 8 trials, 7 of which were in OA, found about a 2-point difference on a 10-centimeter pain scale compared to placebo in the studies that measured it that way. So again, suggesting a real effect, though perhaps modest.
Consistent findings then.
Reasonably consistent for OA pain, yes. There was another trial mentioned using a specific bio-optimized curcuma longa extract called flexophytol.
Flexophytol.
That also showed some pain benefit in knee OA. But similar to the other findings, it also came with reports of more abdominal discomfort and diarrhea.
Right. So the potential for stomach upset seems to be a recurring theme with turmeric supplements.
It does seem to be one of the more common side effects reported in trials.
So summing up the effectiveness part, encouraging signs for knee OA pain, maybe modest, but potentially comparable to something like ibuprofen, but definitely not strong evidence for RI.
That captures it well, but always with that big caveat. The long-term efficacy and, just as importantly, the long-term safety are largely unknown.
Right, that 8-month limit you mentioned.
Yeah, most studies don't go much beyond that. So while it seems likely safe for up to 8 months based on current data, what happens after a year or 5 years? We just don't have that information.
Which definitely raises questions, especially if you're thinking about using it for a chronic condition like arthritis, right?
Yeah.
You're potentially taking it for years.
Exactly. How much long-term data do we need before we can really confidently recommend something like this for ongoing chronic use? It's a really important question to ask.
Okay, so we've talked effectiveness, which is promising but nuanced. Let's pivot to safety now. You mentioned side effects like loose stools. Are there other common ones? And what about more serious risks like interactions? This feels critical.
Absolutely critical. And this is an area where people really need to be careful. Generally, turmeric products taken orally are tolerated pretty well by most people.
Okay.
But side effects can happen. We mentioned loose stools or diarrhea. Other common ones are things like constipation, maybe changes in stool color, heartburn, bloating, nausea, even vomiting sometimes.
So mostly gut-related stuff.
Often, yes.
Eh.
Less commonly, you might see things like itching or maybe some fluid buildup like edema, but the interactions, that's where the real caution flags go up.
Right, interactions with other medications. That sounds like where things could get tricky, maybe even dangerous.
They certainly can. This is super important. For example, if you take medication for diabetes,
Yeah.
turmeric might actually lower your blood sugar. So if you combine it with diabetes meds that also lower blood sugar, you run the risk of hypoglycemia, blood sugar getting too low.
Wow, okay. That requires careful monitoring then.
Definitely. Close blood sugar monitoring is essential if you're using both. And then there's the liver.
The liver, how does it affect that?
Turmeric might inhibit certain liver enzymes, specifically CYP1A2 and 3A4 are mentioned in the sources. Now, these enzymes are responsible for breaking down and metabolizing many other common medications.
So if turmeric slows down those enzymes,
Then those other drugs might build up in your system, potentially reaching higher levels than intended, which could increase their side effects.
it sounds like it could affect a lot of different drugs.
It potentially could. That's why it is absolutely crucial to check with your pharmacist. They have the tools and knowledge to check for these specific enzyme interactions based on everything you're taking. Don't guess on this one.
Good advice. Check with a pharmacist. What about blood thinning? That's something you often hear about with supplements.
Yes, another major one. Turmeric can reduce platelet aggregation. Basically, it makes your blood platelets less sticky, less likely to clump together. Which means it can increase your risk of bruising and, more seriously, bleeding. This is a huge deal if you're already taking antiplatelet drugs like aspirin or clopidogrel or anticoagulant drugs, blood thinners like warfarin, or the newer ones like rivaroxaban, apixaban, dabigatran, and others.
So combining turmeric with any of those blood thinners is risky.
It significantly increases the risk of bleeding complications. You really need to avoid that combination unless explicitly discussed and managed with your doctor.
Okay, that's a very clear warning. And it's not just drug interactions, is it? Can turmeric cause problems with existing health conditions too?
Yes, it can. For instance, if you have gallbladder problems or a history of gallstones, turmeric might actually cause the gallbladder to contract. This could worsen symptoms, potentially causing significant abdominal pain. So probably best avoided if you have gallbladder disease.
Okay, good to know.
Yeah.
What about stomach acid issues? You mentioned heartburn as a side effect.
Right. Because it can cause heartburn, it might potentially worsen conditions like acid reflux or GERD, gastroesophageal reflux disease. So if you already struggle with that, turmeric might aggravate it.
Makes sense. And one more practical point, surgery.
Yes. Because of that effect on platelets, the antiplatelet effect we just discussed.
Reducing clotting.
Exactly. It's generally recommended to stop taking turmeric at least 2 weeks before any planned surgery. This is to reduce the risk of excessive bleeding during or after the procedure.
2 weeks prior. That's important planning.
Very important. And it's not just prescription meds we need to think about with interactions.
Oh, what else?
Other natural health products. So it's not just about the pharmacy drugs. Even other natural things can interact.
How so?
Well, remember, turmeric affects platelet aggregation. Other natural products do too. Things like garlic, ginger, ginkgo biloba, some types of ginseng, red clover. These can also make platelets less sticky.
So if you combine turmeric with, say, high-dose garlic or ginkgo,
You could be amplifying that antiplatelet effect, further increasing your risk of bruising or bleeding. It really highlights that natural doesn't mean interaction-free. You have to consider the whole picture of everything you're taking, supplement or drug.
wow. Okay, that's a lot to consider on the safety side. So let's try and bring this all together. For you, our listener, hearing all this, what are the main takeaways from this deep dive on turmeric?
I think the key points are these. Turmeric does show some genuine promise for helping with the pain of knee osteoarthritis. The effect seems modest, but it's there in the research.
Okay, promise for knee OA pain.
And the safety profile looks relatively good, at least in the shorter term, like up to that 8-month mark we discussed. Right. And these are big buts we really don't know about, its long-term effects or safety. And perhaps most critically, the potential for interactions with medications, with other supplements, and with existing health conditions is real and needs to be taken very seriously.
Which leads directly to the most crucial piece of advice, doesn't it?
Absolutely. Communication. Clear, open communication with your healthcare providers is just paramount. Meaning you always need to tell your doctor about any supplements you're taking or considering taking. Don't assume it's not relevant just because it's natural. Include everything.
Tell the doctor everything.
And specifically regarding interactions, double check with your pharmacist. They are the medication experts. Ask them, could this turmeric supplement interact with my other medications? They can give you the most informed answer.
Excellent advice. Talk to your doctor, talk to your pharmacist. So wrapping this up, turmeric definitely exciting potential, particularly for knee OA pain, as we've heard. But it's absolutely not a simple yes or no. Making an informed choice means weighing that potential benefit against the unknowns of long-term use and the very real risks of interactions.
Yeah.
The clear message from our deep dive today seems to be proactive, get informed, and always discuss supplements with your medical team before starting them.
Definitely. And this whole exploration of turmeric, it kind of underscores a larger point, doesn't it?
How so?
Well, in this whole pursuit of health, with so many natural remedies out there, how do you critically evaluate them? How do we find that balance between respecting traditional wisdom, understanding the actual scientific evidence, and ensuring our own personal safety?
That's a great point. Applying that critical lens not just to turmeric, but maybe to other supplements or health trends we encounter.
Exactly. It's a way of thinking that's really valuable beyond just this one spice, something to mull over.
A perfect thought to leave our listeners with.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from albertarheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upis, technical producer, John Ifun, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive.